With this video, I will demonstrate how to deliver a fetus presenting by the breech. We have three main types of breech presentation. The first is called the frank breech or the extended breech, where you have flexion at the hip joint and extension at the knee joint. This picture demonstrates the frank breech, where you have flexion at the hip joint and extension at the knee joint. The next type of breech presentation is called the complete breech presentation, where you have flexion at the hip joint and also flexion at the knee joint. This picture demonstrates the complete breech presentation, where you have flexion at the hip joint and flexion at the knee joint. The third type of breech presentation is called the incomplete breech presentation. Here there is only partial flexion at the hip joint. If you look at this picture, you can see there is only partial flexion at the hip joint, and this is also called footling breech presentation. Now I will demonstrate how to deliver a fetus presenting as a frank breech. The mother should be in the lithotomy position. Bladder should be empty, and when the perineum is distending, you may consider giving an episiotomy. It is important that you do not act too early in a delivery of a breech. When the perineum is getting distended, you will see the anterior leg appearing, and do not act until the breech has come out and to see the popliteal fossa. The first point of assisting in an assisted breech delivery is when you see the popliteal fossa. Here you have to deliver the both legs. The maneuver that is used to deliver the legs is called the Pinard's maneuver, where you apply pressure at the knee joint so that the knee gets flexed, and abduct at the hip joint to deliver the anterior leg. You deliver the posterior leg similarly by applying pressure at the popliteal fossa and abducting at the hip joint so that both legs gets delivered. At this point, if the umbilical cord is stretched, you could make it slightly loose so that the cord does not get compressed. Your next point of assisting is when you see the inferior angle of the scapula. Here, when the arms are extended, the maneuver that is used to deliver the arms is called the Lovsett's maneuver. Here, when you have the anterior arm under the symphysis pubis, you will go along the humerus up to the elbow joint and try to flex at the elbow joint and deliver the anterior arm. Once the anterior arm is delivered, hold the baby at the pelvis so that you will not hold from the abdominal area to apply pressure on the abdominal organs. Then you rotate the baby by 180 degrees so that the posterior arm becomes anterior, and you use the similar technique to deliver the other arm. It is important that you go along the humerus and go up to the elbow joint to flex the elbow so that you avoid any fractures of the humerus. Once you have delivered the both arms, wait until the nape of the neck appears to deliver the head. Here, the common technique that is used is called jaw flexion and shoulder traction. Now, when you are delivering the head, the most common technique that is used to deliver the head is called jaw flexion and shoulder traction. Here, you support the baby with your left hand and put your fingers at the malar prominences. Your right hand, the two fingers will be at the shoulders, and your middle finger is kept at the occiput so that you can apply pressure to flex the head. So, while you are pressing with the middle finger to flex the head, you apply gentle traction while flexing the head so that head is delivered by flexion. When you have a premature baby, you may apply forceps in delivering the head. I will demonstrate how to use forceps to deliver the fetal head. This is important, especially if you are delivering a premature baby, so that you avoid intracranial hemorrhages. When the nape of the neck appears, you could lift the baby, and at this point it is important that you get an assistant to hold the baby. You take the forceps and you apply like what you do in a normal forceps delivery by applying the left blade first, which is kept parallel to the right inguinal ligament, and then you safely apply the left forceps blade. The next is to apply the right blade by keeping it parallel to the left inguinal ligament. You apply the right blade of the forceps so that they get locked, and your traction at this point has to be downwards and upwards. Once the baby is delivered, you will hand over the baby to the neonatologist. If there is any need for resuscitation, the neonatologist will be able to do so. It is important for the obstetricians and the trainees to practice the skill of delivering a baby presenting by the breech, because you may face this situation at any point in your clinical practice. Once the baby is delivered and handed over to the pediatrician, you should attend to the mother to deliver the placenta and suture the episiotomy as done in any other delivery.